I think we do great things when we work together, when we find that common ground and push for change in our healthcare sector and change that makes a difference in the work and the lives of nurses. I want to thank everybody in this room for your hard work. Day in and day out. You know, I have friends who are nurses, I have cousins who are nurses, I have a niece who recently graduated from McMaster's nursing program, and she's now nursing at the General Hospital in Hamilton. So nurses certainly do touch everybody's lives, not only in terms of, knowing a nurse, but in terms of the hands-on care that you provide, right? I mean, you've provided care for me, you've provided care for people in Ontario, you've provided care for people like my parents and like my son. So the bottom line is the people of this province have been cared for by nurses for many, many years. So I want to thank you for that work, but also thank you for the invitation to speak with you this morning. You know, times are really tough for the people of this province. The people in Ontario are having a difficult time these days. They're worried about their future, and I think nurses are no exception to that. I know that there are many of you who are wondering about the future of your profession and the care that you provide for people. Now more than ever, we need to work together to protect hospitals from cuts that hurt everyday families and negatively impact nurses, not only in the form of layoffs, but also the increased workload and stress that those who are left in the hospitals who didn't get the layoff notice are experiencing because of the loss of their colleagues. As you know, Ontario is currently a minority legislature. Since September of 2011, New Democrats have been very clear that we are doing a job that is an important job, and that job is to deliver results for the people of Ontario and to make our province work. And although it's not easy, we've decided to take the tougher path and to actually work on behalf of people like you, people who actually make sure that our province works and functions. Through 2 budgets, I'm proud to say that New Democrats have been able to deliver some real results for the people of this province. You may recall, in the 2011 budget, we made changes to make sure that budget was more fair. We delivered a new tax measure which asked the wealthiest of Ontarians, those making more, earning more than $500,000 a year, to pay just a little bit more so that we could afford to invest in things like supports for smaller community hospitals. We were careful to ensure that we took a balanced approach when we looked at that budget, one where you don't cut from one part of the healthcare system to find money to invest in community hospitals, for example. Instead, we looked to those high-income earners to contribute a little bit more. You know, after a successful by-election last September, where New Democrats overcame the odds and elected a fantastic new NDP MPP, Catherine Fife in Kitchener-Waterloo, I spent that time looking forward to the fall and the winter, where I thought we'd be able to continue to deliver more results for Ontario's families. But unfortunately, the Liberals had other plans, and they shut down the legislature so that they could focus on some of their own internal party interests. When that happened, though, we didn't just sit back and relax. New Democrats took the opportunity when the legislature was shut down or prorogued to get out of Queen's Park, to get out of Toronto, and to spend some time across Ontario talking to Ontarians about their priorities and how we could improve the 2013 budget when it was going to be introduced. And people told us some pretty basic things that they wanted to see. They were worried about home care for their aging parents and loved ones. Some seniors waiting as long as 262 days to get the home care that they need, and that's after they had been approved for service. Not acceptable. We proposed a modest investment to ensure that anyone approved for home care was guaranteed that they would receive that care within 5 days. And we also proposed a change that, for a change, the CEOs in hospitals who are earning more in 1 week than most people earn in a year could wait a little longer for their next pay hike. Because we were pretty clear. If we invest in home care, we need a plan to pay for it. We shouldn't be cutting services in hospitals to pay for home care in this province. And so again, our plan was pretty balanced. We included cost savings and new revenues so that we wouldn't need to cut hospitals. But unfortunately, the Liberals refused to cap CEO salaries or find identified savings in LHINs and CCACs, and that is having an impact right now, as you know, as all of you know, in our hospitals in Ontario. Beds are closing in London, Scarborough, and hospitals in Ottawa, Perth, Chatham, Muskoka, and Windsor are all experiencing cutbacks. And given the way that the government actually communicates with individual hospitals, there may be cuts around the corner that hospitals themselves don't even know about. That doesn't just affect patients. It affects nurses too. The province has never addressed the compensation differential between nurses who care for our loved ones in institutions like hospitals or clinics or long-term care settings and those working in community. I'm pretty concerned about what this means for community care in the long term, because nurses are providing frontline care wherever they are, whether they're in an ER in the hospital, whether they're helping people live and die with dignity in a palliative care center or hospice, or providing care in the home so that seniors can stay healthy and active within their own communities. Nurses deserve to be treated fairly no matter where they work. And we shouldn't simply accept as inevitable a two-tier system here in this province. And you know, there really are challenges facing our healthcare system. I think we all recognize that. There are challenges that face our healthcare system as it changes and evolves. But there's something that I am certain about, and that is that cuts to nurses and frontline staff are not the way to transform healthcare. In fact, the way I see it, we need more nurses on the job instead of less. Our population is aging, and we need to be sure that our healthcare system will be responsive and ready for that demographic shift, and we're already in it. It's not like that shift is coming 10 or 15 years down the road. That shift is upon us right now. And so it means long-term planning, not short-term fixes that introduce the private sector into our healthcare system. Those are not the kind of fixes that we need. More private sector participation in our healthcare system is not the thing that's going to fix the healthcare system or that's going to help us get through the changing demands that we're going to see on that system. And you only have to look at things like the scandal at Orange, the Orange Air Ambulance system, to get a real glimpse of what that looks like, what that privatization agenda looks like. And I think we'd all agree it wasn't pretty. The recent mess over chemotherapy drug underdosing only emphasizes the need for strong oversight over cancer medication and our entire drug supply, and the real danger of sacrificing oversight for cost savings. And you know, in addition to that slow creep of privatization that's occurring, we need to be vigilant about cuts. We know that while New Democrats put forward a home care plan that we could fund without cuts, the government chose to pay for home care by cutting hospitals or implementing freezes. And let's call a spade a spade. A freeze is a cut by another name. So the Liberals are claiming that the cupboard is bare for frontline health care, and yet they're able to find money for sky-high CEO salaries. You know, it makes you want to scratch your head. People wonder why the government is choosing to give well-connected CEOs raises while beds are closing. People's trust in our system is eroding, and frankly, I believe that lives are at stake as a result. So how do we achieve results in healthcare? How do we ensure that the system is there for us when we need it and functioning well? I think the most important factor is being able to invest without cuts. And to do that, we need to ensure that there is steady funding so that we can make good, long-term decisions. We need to make sure that our financial house is in order in the province. You know, New Democrats have some lessons to teach when it comes to balancing the books and keeping a careful eye on the public purse. You may not realize this, but research shows very clearly that New Democratic governments have run fewer deficit budgets than any political party across our nation. And we've run smaller deficits as a share of provincial GDP. And we've achieved those successes by taking a very balanced approach, looking carefully at those respective provinces' revenues as well as their expenditures, and by ensuring that government is accountable and transparent. That's why we focused in this last budget session on delivering a financial accountability office here in Ontario. And it's a new office that's going to be established in September, and it's modeled after something called the Parliamentary Budget Office, which is in Ottawa. And that one was so successful in peeling back the layers of spin and Enron accounting tricks that are used by governments. It was so successful that Stephen Harper actually tried to shut it down. So we know that something like that can be effective. It'll give people a real chance to get independent verification about government spending claims. And that's something that the people of Ontario, I think, today recognize more than ever before that we need desperately. Because there's an intimate relationship between provincial budgets and health care. And we all know that. We all know the portion of our budget that is used for health care investment. But if the government's handing out billions of dollars in no-strings-attached corporate tax giveaways that don't create jobs, or creating brand new HST loopholes to make it cheaper for Ontario's biggest corporations to wine and dine their clients, that revenue loss is going to put pressure on our healthcare system. So we need to question where this government's priorities are. CEOs or the patients that you care for each and every day. Now, believe it or not, I actually realize that no one gets into nursing for the money or the cushy hours, right? You're here and you do your work that you do because you care. And we all know that people put high expectations on you. And I want to tell you in closing what you can expect from me and what I think I've been demonstrating since I've taken over the reins of my party. My job is to put people first. You can expect results from me, and you can expect New Democrats will deliver. And I look forward to working with you, with Linda, the rest of your organization, to make sure that we not only protect our healthcare system and our hospitals, but we improve it and make sure nurses are playing that large role that they should be playing in delivering the future healthcare needs for the people of our province. Thank you so very much for your time.